So this project was established just after the referendum to repeal the 8th Amendment, which was to remove the abortion ban from our constitution. So what we intended to do was to gather from stakeholder organisations as well as research data and to archive and preserve this data for the future. So material that we have includes Together for Yes, Abortion Rights Campaign, Doctors for Choice and others. Stuff that we've published so far includes public publications, minutes of meetings, agendas, images, and lots of other material. There's also research data sets. Linda Connolly here, Professor Linda Connolly from Mussey. She carried out interviews in the 70s and 80s with activists. We've archived those interviews as part of the project. We also Camilla Fitzsimons, who's also based here in Maynooth. She carried out interviews with activists during the repeal campaign from 2015 to 2020. We've also archived those as part of the collection as well. What I really want to talk about today is archiving the In Her Shoes Facebook page. So for anyone who's not familiar with the page, it was where women shared their experiences of abortion prior to legislation in 2019. So in doing this, a lot of the stories contain many much sensitive material, for example, sexual violence, rape, intimate partner violence, and etc. So I suppose one of the things that we talked about when starting this project was some of the ethical conundrums, if you like, of working with such sensitive material. What we have done so far is we have 1,394 stories exported from Facebook. 614 of these are ingested in the repository. They're not available to the public at the moment. We want to work on that. But they are up there and available to anyone doing research in the area and for educational purposes. So the first thing was how to apply categorization to ingest the stories in the archive. As much of the material is sensitive material, we talked a lot about the importance of language. So one of the first things we did was to sociologically go through and code each of the stories. And from these codes, the metadata descriptions were developed. And from there, we took archival categories. So there was a lot of discussion around how to use best language. So in order to do this, we set up a stakeholder advisory forum. This is a group of academics who work in the area of reproductive health and in the areas of ethics, research ethics. So in terms of sexual violence and rape, we decided on using the word consent, and there's many other issues that I don't have time for today. What is ongoing at the moment is the anonymization of the stories. I'm currently drafting an anonymization statement that we're seeking approval from our stakeholder forum for at the moment. So we understand that many of the women shared their stories on the page because they wanted to share their lived realities and to counter public stigma against abortion as well. So the question was, to what level do we anonymize these stories? So direct identifiers such as names, any place names, date of births, birthdays, they were all removed. However, we do feel that it's important that the stories are preserved with as little interference as possible. So a low level of anonymization has been chosen. So some details, specific details that might be known to someone who knows the person, they might be able to identify them. But it's our intention to protect the author from being identified from the general public. So in order to, I suppose, give openness and transparency to all of these ethical conundrums, if you like, we developed an ethics protocol where we outlined each of the ethical issues and then our decisions along the way. So this is an edited document. We edit it from time to time as we go along through the project. and it's to be open and transparent, and this is also these issues are also published on the Facebook page so that those who posted are aware of the project and what we're doing throughout. So, as I said, many of the stories include sensitive material. It involves reading through over 1,000 stories. So we were thinking about the impact that it would have on me as the researcher. So we developed a self-care protocol. This is basically a list of practicalities that I can do as a researcher in order to try and prevent harm to myself. The protocol was published alongside the collection. We urge anyone who is working with the In Her Shoes collection to also have a look at this protocol and develop one that suits themselves. And it's also available for anyone who is working with sensitive and potentially traumatic data. So that's kind of where we are at the moment. I just want to also mention that we recently won an award, the Digital Preservation Award, so we're very proud of that. And we're funded by the Wellcome Trust. And we're here in Mossy, and we're called Archive and Reproductive Health. Thanks very much.